Hello, hi everyone. This is 𝐒𝐤𝐞𝐚𝐤𝐲 from Neethus Academy. In this video, we will focus on sentence construction. That's OET speaking cards easy sentences construct and that too using the words available and present on the card itself. So, if you struggle in constructing sentences while doing the role play, this video is for you. So let's have a look at a cue card. This is the card. So you can see the setting is given as a hospital outpatient clinic. Let's read the background information together. You're talking to a healthy man who is concerned about developing diabetes due to family history. The patient is avoiding all sugary foods because of his fear of becoming diabetic. His spouse is concerned about this extreme behavior and has encouraged him to seek medical advice. Your role is to reassure and advise the patient about managing his concerns. So we got a picture about this context. Ini idoru non case aano unknown case aano nu koodalayi manasilakan first task kuda namukku onnu vaichu nokkam. The first task is find out the reason for the visit. This single sentence tells you it is an unknown case. Etra information in the background detail undegilam except the cases where it is mentioned just examined anganthe cases onnumalla njan samsarikkunnathu normal aayittu patient ne pattittu oru details okke thannittundengilam like ee oru case il thannittulla pole thannittundengilam if your first task is find out the reason for the visit, that is definitely going to be an unknown case. appo namukku manasilayi idu endayalum unknown case aanu, so I need to grade, say who I am, get the name of the patient here, and then ask how can I help them. When they tell me this is a reason why they are here, I have to provide my initial assurance and then move to my next task. These 3 steps are eniki cheyanulladu. So let's have a look at that. Good morning. My name is Richa. I'm one of the registered nurses working in this outpatient clinic. Could you please help me with your name and age? Alright, my name is David and I am 32 years old. Yes, David, tell me what can I do for you today? So this is how I'll be starting this role play. So when I ask this question, David is going to tell me, I have this strong belief that I'm going to develop diabetes and I am avoiding all kinds of sugars, but my spouse is not happy about it, so I think I'll have a talk about this with you. So you're going to acknowledge this concern and the reason why he is here. You can try something like, okay, Mr. David, I totally understand the reason behind your visit. Please don't worry, you have reached the right place. I will do the needful for you. So before we get into any further discussion, I would like to check with you what is your understanding about diabetes mellitus. So when you ask this question, just imagine Mr. David is telling a vague answer like, I just know that if you eat too many sweet or too many sugar foods, you will be diabetic. This is what I know. Okay, this is what Mr. David said. So you're going to explain what is diabetes mellitus to the patient. You can say, well, Mr. David, what you said is partially right. So I'll tell you more about what is diabetes mellitus. It is a condition in which the blood sugar levels are higher than normal. There are 2 types of diabetes mellitus, type 1 and type 2. Type 1 diabetes mellitus is where the body doesn't produce enough insulin, whereas type 2 diabetes is where the body doesn't use insulin effectively. So I hope you understand the different types of diabetes mellitus. Do you have any questions to ask me? Itreen cheyumbo, your first and second task are complete. Okay? Now let's look at the next point. Do you have any concerns? Ennulla automatic aayittu ivide thannittulla transition question chodikkumbol the patient will ask you a question. Yes, I have this huge concern. I have a family history of diabetes and that is the main concern that I have. I think I will also have high chances of being diabetic because of this. Is that true? Okay, so this is the question raised by Mr. David. What is the explanation given here? Inform the patient's family history is a risk factor. ഒരു പക്ഷേ അതൊരു റിസ്ക് ഫാക്ടർ ആയിരിക്കാം അല്ലെങ്കിൽ അതൊരു റിസ്ക് ഫാക്ടർ ആണ്, not necessarily എന്നാണ് ബ്രാക്കറ്റിൽ തന്നിരിക്കുന്നത് അല്ലേ. So let's see how we can construct a statement or a response here. Mr. David, now I totally understand why you are really worried. So yes, your family history of diabetes could be a reason. Okay, you're using could be. That means you're just telling the patient, adavam, possible ആണ് എന്നുള്ള രീതിയിലുള്ള explanation ആണ് നമ്മൾ പറയുന്നത്. Okay, but you're also going to add not necessarily. Okay, so let's see how we can complete a statement there. Well, Mr. David, now I totally understand why you are really worried. Yes, your family history of diabetes could be a risk factor. However, it is not necessary just because it runs in the family, you will also have it. You see how I did that? I used however to connect these two statements and I finished my first explanation there. Now your next point is find out whether the patient has any signs of diabetes like increased thirst, frequent urination, unexplained weight gain, fatigue, blurred vision, etc. So this is information gathering which comes right after information giving. So ഇത് രണ്ട് type of കാര്യങ്ങളായതുകൊണ്ട് you need a signposting statement in between. So you can try something like, moving on, I would like to ask you some questions to understand whether you have any signs of diabetes. So may I? So you signposted and you took permission. You're going to ask the questions. The first one is, do you experience increased thirst? Patient says, no, I don't. The next question, what about urination? Do you feel like using the washroom quite often, or do you notice any changes in your urination patterns? ഈ ഒരു രീതിയിൽ എന്തെങ്കിലും ഒരു question നിങ്ങൾക്ക് ചോദിക്കാം. Okay, or do you have increased urination എന്ന് ചോദിച്ചാലും മതി. So patient says, no, nothing like that. The next point is unexplained weight gain. So you can ask the question, so have you gained weight recently? Okay, the next one is fatigue, blurred vision. In two points, so you can ask them together. So you can ask like, so do you experience fatigue, or do you feel tired all the time, or do you have any blurred visions, etc. So you can ask the questions together. You will get a reply to that as well. So the patient says, yes, I do feel tired most often, but I think it's mainly because of my work. Okay, so you're saying, okay, thank you very much for answering all my questions. From what you told me, I understand that you don't have any initial signs of diabetes as of now. The reason why I'm adding as of now is because naale varadirikam. Okay, so we don't know that, right? So I'm just adding the point as of now here. So once you have done this task, it is important that you check the understanding of the patient, or you can check like okay, am I right? Because you gave a summary, so the best way to do that would be by asking a question like, am I right? So you're kind of like reconfirming. So the patient says, yes, you are right. അവിടെ നിന്ന് you are going to explain the causes, which is the next task. So ഇവിടെ what you can do is you can use a specific question for a transition. അടുത്ത പോയിന്റിലേക്ക് നമുക്കൊരു transition വേണം അല്ലേ? So you can ask a question like, so Mr. David, do you know the possible causes of diabetes? So the patient says, yeah, I know it. If it runs in the family, you have a high chance of being diabetic. That's all I know. So you're going to explain one by one, okay? So you can start by saying, Mr. David, what you said is right, but there are other causes as well, such as it could be lifestyle factors, or there could be other medical conditions which contribute to it. It's not just the genetic that works here. Okay, so that is how you can explain that point. It's just one of the ways of doing it. And then you have the next point, explore the relevance of these to the patient. So ഇവിടെ എന്തെങ്കിലും ശ്രദ്ധിക്കേണ്ട ഒരു പോയിന്റ്, ഓൾറെഡി ഫാമിലി ഹിസ്റ്ററി ഉണ്ടെന്ന് പറഞ്ഞത് കൊണ്ട് നമ്മൾ പിന്നെയും ജനറ്റിക്സ് ഉണ്ടോ എന്ന് എടുത്ത് ചോദിക്കേണ്ട ഒരു പോയിന്റ് ഇവിടെ വരുന്നില്ല അല്ലേ, ബിക്കോസ് ദാറ്റ് വുഡ് ബി repetition. So you can avoid that point and you can add one sentence and say, so you told me that you have a family history of diabetes. So apart from that, any of these causes sounds relatable to you എന്ന് ചോദിക്കുമ്പോൾ that is done. So patient says, ഇല്ല, വേറെ ഒന്നുമില്ല, ജനറ്റിക്സ് മാത്രമേ ഉള്ളൂ, ബാക്കി കാര്യങ്ങളൊക്കെ ഞാൻ വളരെ നീറ്റായിട്ടാണ് ചെയ്യുന്നത് എന്നുള്ള രീതിയിൽ പേഷ്യൻ്റ് റിപ്ലൈ തന്നു. Okay, so now you're going to reassure the patient. So you can directly move on to that task. So you can start by saying something like, well, Mr. David, I totally understand you're quite overwhelmed thinking whether you might be diabetic. But if it gives you any peace of mind, I reassure you that avoiding sugar entirely is unnecessary. What you need to do is to have small amounts as part of a balanced diet. So what I'm trying to say is you do not have to cut short entire sugary foods just by thinking that you might be diabetic. Now, in case if you're really worried about it, I would highly recommend alternatives like natural sweeteners like honey or stevia, and you can eat more fruits if you want to have something sweet. So I hope that will be okay with you. The patient says, yeah, that sounds better for me. So that is how we can finish that portion. Now we have find out any concerns or questions. So you can ask a question. Do you have any other concerns or questions to the patient? So patient asks you, yes. So how would I know whether I am becoming diabetic? So what should I be doing? Should I be coming for any test, or should I be doing anything else? Okay, so this is a question raised by the patient. So you're going to consult the patient. Mr. David, I totally understand you're really worried about the possibility of being diabetic. So let me tell you some of the measures you can take to know whether there are any changes in your body. So it is advisable that you undergo annual blood checkups. Most importantly, please maintain a healthy lifestyle, exercise regularly, and eat a well-balanced diet. It is also important that you do some measures to manage your stress, because you told me that you work a lot. ഈ കോൺവെർസേഷൻ്റെ ഇടയിൽ പേഷ്യൻ്റ് സൈഡിൽ നിന്ന് പേഷ്യൻ്റ് പറഞ്ഞൊരു കാര്യമുണ്ടായിരുന്നു അല്ലേ, വർക്ക് റിലേറ്റഡ് ആയിട്ട് കുറച്ച് സ്ട്രെസ് ഒക്കെ ഉണ്ടാവാം എന്നുള്ള രീതിയിൽ. ടയേർഡ് ആകാറുണ്ടോ എന്ന് നമ്മൾ ചോദിച്ചപ്പോൾ പേഷ്യൻ്റ് പറഞ്ഞിരുന്നു വർക്ക് റിലേറ്റഡ് ആയിട്ട് ഞാൻ ടയേർഡ് ആവാറുണ്ട് എന്ന് പറഞ്ഞിട്ടുണ്ട്. സോ ദാറ്റ് മീൻസ് ദ പേഷ്യൻ്റ് മൈറ്റ് ബി ഹാവിങ് എ ഹെക്ടിക് വർക്ക് ജോബ് or a work culture. So ആ ഒരു പോയിന്റ് വെച്ചും നമുക്ക് ഇവിടെ വേണമെങ്കിൽ കണക്ട് ചെയ്ത് പറയാം, which is kind of like optional, but if it is done, it is good. Okay, so that is how you can convey that point. And then you can ask whether it is okay with the patient. Is that okay with you? Patient says, yes, that's okay with me. Then you can start by saying, I hope everything is clear to you. Do you have anything else to ask me? Patient says no. You can reassure again. Well, in that case, there is nothing for you to be worried about as of now. All you need to do is to follow all the instructions correctly to prevent any complications in the future. So, Mr. David, please take care of yourself. If you need any further information, feel free to contact us anytime. Take care, Mr. David. This is how you can finish this entire conversation. So I hope you got a clear understanding about the sentence constructions. You understood how the tasks were done, how the transitions were done, and I hope overall explanation is clear to you guys. So keep practicing and make wonders by using the same words which are present on the card itself. So if you struggle with sentence construction, that could be a very easy method of sentence construction here. So I hope this video helps you. So if yes, let us know in the comment section. I'll be back with another informative video very soon. Until then, take care. Bye everyone.
Neethus Academy, India's #1 language academy.